My name is Alina Navarro. One of the things that we saw was that COVID was impacting people of color at a higher rate. In doing that research, we did find that Green Valley Ranch did not have a lot of providers doing COVID work.
I'm Ugo Obina. Green Valley Ranch is a community in the northeast part of Denver. We are just slightly south of the airport and north of Aurora, and it's a very fast-growing community, very diverse community.
My name is Dr. Augustine Obina.
Through the pandemic, we have had to work hard to separate our primary patients from patients who may have COVID-19 symptoms.
My name is Amanda Hasley. There's a significant gap in healthcare right now where people are presenting to their primary care or urgent care settings and not being able to be seen in person.
Green Valley Ranch is a very innovative clinic as they do integrated behavioral health, they have urgent care, and now they have a COVID clinic. They truly are focusing on the needs of the community.
The extra funding that we received from Colorado Access was very timely, and it was very helpful because just at the point at which we received it, we were realizing that there was a certain group of patients that we needed to bring in. Those were patients that had COVID-like symptoms, but maybe were not sick enough to be at the emergency department, but sick enough to be able to be seen. And because of the need for separation, we were not able to see them at our regular urgent care. And so what we were able to do with the additional funding is to secure a separate suite in the same building, and also to be able to bring on an additional provider, an additional staff, to be able to see those patients.
So we're able to kind of take some of the burden off of the emergency department. It's great in a community with so many health disparities to begin with, and for people who have limited access and transportation to get to the drive-in testing sites.
And so that's kind of an advantage of our facility, is that not only can you be tested, but you can also at least be evaluated and see what else you might have that we need to take care of.
Part of a good respiratory exam is actually seeing someone, listening to them, and identifying any issues that you're seeing within their examination, and we're able to do that here in addition to doing COVID testing for them.
We're dedicated to this community in Green Valley Ranch, and whatever we need to do to keep our patients healthy, we're going to do it. When the vaccines are finally available for the general populace, we're hoping to participate in that.
Getting most people vaccinated is our best chance of getting back to normal life as soon as possible. And even those people who had COVID-19, who had had the vaccination, actually had very mild disease and did not end up in the hospital or dying. So the vaccines have proven to be very effective. This is the right thing to do, and the risk from side effects, the risk from dying from the vaccine is absolutely incomparable to the risks you run from getting the actual infection.
We're hoping to keep the COVID clinic open as long as the community needs it, and we just try to be flexible.
The future for Colorado Access and Green Valley Ranch is bright because we value them as a provider. We value them in providing cultural responsiveness care. They are very responsive to the needs in their community.
I actually want to express our gratitude from Dr. Obina, myself, and from the whole Green Valley Ranch Clinic staff for your partnership, which has been ongoing for a number of years now. We really appreciate the fact that you're very sensitive to the needs of the providers in the community.